Rachel Wall, founder of InspiredHygiene.com, and today I want to talk to you a little bit about the number one most common reason that hygienists run behind. So this is something that we all struggle with. You know, I'm still practicing hygienist and I struggle with this sometimes too. There's a lot to do in a short period of time when you think about reviewing medical history and blood pressure and risk assessment and photographs and x-rays and clinical care, the scaling and polishing and home care review and all the things that go into a visit. There's a lot to do. So time management is critical, and that's something that we can always improve on and work on throughout our career. So whether you're a doctor or a hygienist, I've got a couple tips for you. So these are all some of the reasons why we may run behind, right? Too much talking about things that aren't pertinent to the dental visit, or even too much talking about needed treatment instead of being succinct and using photos and so on. Doctor exam, whether you have to wait for the doctor exam or if you're the doctor and you feel like it's taking you too much time because you like your hygienist to maybe tee up the restorative needs a little bit better so your exam can be more efficient and shorter. Too much scaling, not being prepared, so seating the patient and then having to run and get the sensor, things like that, not having everything in the room so that when the patient sits down you can start working right away. Only hand scaling, so not utilizing ultrasonics, definitely a reason for running behind. And just general poor time management, so not kind of watching the clock and knowing how to allocate certain periods of time to different things. So you may have heard our concept, and it's not something that I invented, but something that certainly is tested and time proven, is the 20-20-20 rule, where in a 60-minute hygiene visit you spend 20 minutes on the exam and data collection, 20 minutes on scale and polish, and 20 minutes in the doctor exam, turnover in the room, making the patient's next visit. So what I see as the number one most common reason for running behind is too much scaling. So it's violating this 20-minute rule, where if a patient needs more than 20 minutes of scale and polish, then they might need something other than a prophy. And we need to really start thinking about that. And so if we do the proper things in the first 20 minutes during our exam, like a complete perio-charting, bleeding index, all of those things to really assess what they need, then we may be able to recommend certain treatment that's something other than a prophy. So here's the thing. I'm not saying that you leave calculus or you don't do a good job. That's not what I'm saying at all. What I'm saying, though, is to properly identify, are we doing a lot more scaling than what was designed to be done during a prophy? So if you're going any deeper than 2 to 3 millimeters below the gingival margin, if you're seeing lots of bleeding in many areas, then that's indicative of the patient needs something other than a prophy. And we need to properly define what that is. So there's a lot that goes into this. A lot of it is unraveling of behaviors that have happened over years and years, where everybody gets a prophy or we do the difficult prophy, and maybe some of those patients really need to move into periodontal. So there's a lot of mindset, a lot of training that goes into that. But one thing that you can do really quickly is start timing yourself or timing your teammates with their permission, and looking at how much time are you spending on the scaling as a general rule. Because here's the thing, if you're spending 40 minutes, then all of a sudden you've got 10 minutes here and 10 minutes here. And so this is where critical things begin to be left out, like using the intraoral camera or doing a complete perio charting. So if we really identify why are we spending 40 minutes on the scale and polish and find a solution to that, like perhaps a proactive perio protocol, we can really cut the scaling time down and really be more professional and more thorough with our data collection and risk assessment. So time yourself, see how much time you're spending on here. This may be a big clue that it's time to reevaluate and refine your perio program. Thank you so much. Don't forget to check out InspiredHygiene.com.